So, Nivedita, how are you today? All get up to ask me questions?
Yes. So today I have very interesting questions for you.
Mhm.
So
You always have interesting questions.
Yeah. So these pregnant women, the girls who come to us, so say for example, somebody is 38 weeks pregnant and they come and ask, Doctor, I want only a vaginal delivery, a natural delivery, and not a cesarean section. So, how do you answer to that question?
So, obviously, all women, most women, let me not say all, that's wrong. Most women would prefer a vaginal delivery for its advantages. Um, but what is important to remember is that one cannot categorically state that you will have a normal delivery. Women, even after 3 or 4 normal deliveries, can have a cesarean section. So, and these questions we get right at the beginning of the pregnancy or towards the latter half of it. So, what we tell them is look, you can try your best and we can try our best. But there are so many variables, both during the pregnancy and during labor, that we cannot guarantee that you will have a normal delivery. And I'm sure you in your practice have heard people coming to you with their second pregnancies and saying, Ella normal ittu andre doctor, but I'm a cesarean agoitu. A pregnancy can be completely normal, but labor is different. Labor is the actual process during which one determines, or nature determines for that matter, whether you will have a normal delivery or a cesarean section.
Yeah. So for the clearer understanding, I think you should tell like we tell, like you tell the passage and the
Yeah.
passenger and
Yeah,
the power.
Yes.
Yeah.
So, as I tell girls, and you know that, and the boys who come with them, that there are 3 P's. The fourth P is Prathima, of course, but there are 3 P's: the passenger, the passage, and the powers. So, who is the passenger? The passenger is the baby. And the baby's got to be of an average size to go through the pelvis, the mother's bony cage. Now, what is the passage? The passage is the pelvis, and the mother's bony cage should be big enough to accommodate this baby. And the powers are the contractions. The contractions are the ones that push this baby down and out. Now, if your passenger is too big for this average passage, he or she is not going to fit through. Of course, a small baby will come out. The passage, if the passage is slightly narrow, these days we do not, at least in the women we see, we do not have rickets and therefore very narrow passages or pelvises, but that passage can be slightly narrow in certain diameters, which will not allow the baby to come out. And the powers or the contractions, they may not be good enough, despite giving all the medication that we have in modern obstetrics, to push this baby down and out. So people don't realize that there are a whole host of factors which come together appropriately and correctly in order for women to have a natural delivery. And of course, going back to the passenger also should behave well. Now, if you have a passenger, that's the baby, whose heartbeat is going up and down, then I cannot wait for a natural delivery if that's going to take a few hours, because we cannot compromise the baby at the cost of a vaginal delivery.
Right. And the second thing that they are scared of is the pain.
Mhm,
So they think that the epidural increases the chances of cesarean delivery. That is one thing. And what is your take on cesarean on maternal request?
So the epidural does not increase the chance of a cesarean section. The other common worry is it increases my chances of a backache. It does not, because it's been in place for several years now, several decades, and there has been no evidence to say that it increases the risk of backache. Coming to maternal request and cesarean section. Well, there are some women who have a morbid fear of vaginal deliveries. And there are some women who just do not want to go through a vaginal delivery. So, what we do counsel and advise them is that a cesarean section is a surgery. And like every other surgery, it has to be done with an indication and not just at request. We also make them aware about the problems that can be associated, mainly at cesarean section. They can be bleeding. Post cesarean section for the next pregnancy, obviously the chances of a vaginal delivery come down. And also this condition called placenta previa, which can then give rise to other problems, may occur with previous cesarean sections.
In the next pregnancy.
In the next pregnancy, yeah.
Yeah. And the very common question that come up every day is a woman who had a cesarean section, say for example, 2 years ago, 1 year ago, 3 years ago, and they come up and ask, I want a vaginal delivery only. I don't want to deliver by cesarean this time.
Yeah.
So what is your take on that?
We certainly encourage trial of labor after previous cesarean section or a vaginal birth. But we also counsel them adequately because there are a few important things that a woman needs to know before we start off on this journey of a vaginal birth after a previous cesarean section. What she needs to remember is that because that is an area of weakness, there can be a rupture rate, which means the uterus bursts open. Of about 1 in 200 women can have this. And in such a situation, the baby is lost and the mother is quite ill because of this catastrophic event. They also need to understand that in selected cases, the vaginal birth rate is high, but in certain other cases, the vaginal birth rate is not very high. And typically in modern day obstetrics, we would like to wait for spontaneous onset of labor, which means without giving any drugs, because that gives us the best and the safest chance of a vaginal birth. Yeah, but I think that's a topic we'll have to discuss a bit more in detail later on.
Yeah. So
Yeah.
the message should be a safe delivery, I think.
Yes.
Yeah.
Yes. It has to be a safe delivery of both the mother and the baby, and making sure that all this is done in a controlled environment.
Yeah.
Yeah.
Thank you.